Hey everyone, and welcome to the FLATLINING Podcast from Fulcrum Strategies. I'm Matthew Handley, and with me is our president and CEO, economist Ron Howrigon. Ron, how are you, sir?
I'm good. I hope you are as well.
I am. I want to start today by following up on a story we've talked a lot about. It's something that has affected a number of our clients in an adverse way, and that is the Change Healthcare cyber attack. Ron, you mentioned to us during a staff meeting this week that they have admitted to have paying the ransom. Do we know how much UnitedHealth Group paid to release the Change Healthcare system?
So I don't think they've confirmed the actual number. The rumor is $20 million.
Wow.
But that's, and yeah, $20 million is not an insignificant amount of money. Now, given the amount of damage and how long Change was down, it brings the question for a company that makes over $20 billion a year in profit. When did they pay the ransom? Why did they wait so long if they did wait? If they could have brought Change Healthcare back up by paying a $20 million ransom earlier, I think that needs to be looked into. Mm-hmm. And it always raises the question of, well, since they in some ways profited from Change Healthcare being down on the insurance side, and there's some questions about a couple of practices they were able to buy because those practices got into financial trouble when Change Healthcare is down. It just raises a lot of questions about what were their real motivations, if they waited, why did they wait so long, and why did they profit from this long-term profit from this scenario. Just there's a lot of really uncomfortable questions about all of this, especially given how much damage it did to the healthcare delivery system in this country.
On Wednesday, May 1, the CEO of UnitedHealth Group, Andrew Whitty, will be testifying before a subcommittee. It's from the House Energy and Commerce Committee and the Subcommittee on Oversight and Investigations. That's run by Representative Kathy McMorris Rogers and Morgan Griffith. He's going to be talking about the Change Healthcare cyber attack, and Chairwoman Rogers said Americans are still dealing with the fallout of the Change Healthcare attack. Individuals and smaller providers have struggled financially, threatening critical access to patients. They were disappointed that UnitedHealthcare would not join them for their health subcommittee on cybersecurity, and they look to have the CEO there as well. Now, back on an earnings call earlier last month, UnitedHealth Group CEO Andrew Whitty said that it's a good thing that UnitedHealth Group owned Change Healthcare because he seems to think that if Change Healthcare had the cyber attack without their ownership, it would not have come back, which is an interesting way to look at the situation, isn't it?
Well, to me, there's a couple of problems with this statement, and you gotta credit the guy for hubris. With how bad that was to sort of try to get in front of him and go, actually, you're lucky, that we owned them. First of all, he said that this attack likely still would have happened even if they hadn't been owned by United, and I think that's a stretch. How do you know that they would have had Change Healthcare if not owned by United? And how do you know they didn't pick Change Healthcare because it was owned by such a profitable corporation? Meaning, otherwise, it increases the likelihood of being able to get a ransom. It's I heard somebody else talk about this and said, of course they did it because it was owned by United. Just like people don't kidnap the children of poor people.
Right.
You go after the rich people because they can pay. The other thing is, his statement about it, he said, it would have left Change Healthcare, I think, extremely challenged to come back. As if UnitedHealthcare brought them back quickly, which they didn't. Mm-hmm. How much more challenged can you be? I actually think, it's my opinion, and I'll preface this up front, that if Change Healthcare was still a standalone company, they would have paid the ransom, paid it sooner, and gotten back sooner. And I think actually the chances of them being attacked probably would have been reduced if they were by themselves, because they probably would have been able to get a couple $1 million out of them rather than $20 million. Mm-hmm. Now, those are my opinions. But so I think his statement had a lot of problems with it. And like I said, at least you got to give him credit for the hubris.
I know we've talked about this before with the idea of cybersecurity in healthcare, because it's an issue. Patient privacy is an issue. Obviously, with this instance, you have the ability for claims to get paid is a big issue for providers. Even the federal government, even though their official stance seems to be, hey, don't pay ransoms, they also seem to say, yeah, but we understand when you do. I know one of the leading, perhaps, critiques of paying the ransoms is that it encourages it to happen again. But on the flip side, you talk about if you don't pay the ransom, if you don't pay that $20 million to open up Change Healthcare again, you're putting a pretty significant part of the system at risk, are you not?
You are, and it's, especially when you're talking about healthcare, it impacts doctors' ability to get paid. It impacted pharmacies' ability to fill prescriptions. It's not something that is without concern of when it gets, when it's eliminated. I will tell you that, one of our clients got, and probably more than one actually, have been hit by cyber attacks. Usually when it's a physician group, it's a small dollar fee. And everybody, including the insurance companies that provide you this kind of cyber attack insurance, say, pay the damn ransom. Because it's quicker, it's easier. It avoids a lot of other unpleasant things. I mean, there's a story out now that one of the people who hacked, who didn't get paid by the other group, I guess there's no honor amongst thieves, now is threatening to release a lot of patient information that they have because they haven't been paid. So I get the whole don't pay ransom because it just begets more ransoms. But if you don't, you've got to all stop paying them, and then you got to go through the pain of what happens when you do that, of these things being down and down for a long period of time, because you can't just rebuild them that easy.
Yep. Let me ask you about that last remark you made about the other cyber group. If that were to happen, and this other ransomware group decides to release that patient information, who's at fault for violating HIPAA in that instance? Is it Change Healthcare or is it the cyber group?
Well, obviously the cyber group is at fault, but nobody can punish them for HIPAA. They're not in this country.
Right.
The question becomes on the HIPAA violation, whether it's Change Healthcare is at fault, is, was there sort of gross negligence there?
Right.
Perfect example is, let's say you're a medical office and you do everything right and you're secure, you do all your systems, and somebody physically breaks into your office and physically steals something that, paperwork, lab slips or whatever that have patient identifiable information, and then distributes it. I don't think that medical group is at fault. They did everything they could to protect it. Now, if you leave the door wide open, or and this is actually a real thing, I know medical groups who had doctors back when there were paper charts that were taking paper charts home with them in their car. Well, that's not a secure environment, and if if somebody breaks into your car at night and steals them, you've got some liability there because you didn't take due caution or due care. So I would doubt that Change Healthcare is at fault because of the way that information was obtained. They tried to protect themselves. They just got hacked.
Yeah. Well, I'll be interested to see this House subcommittee hearing. It is streaming on their website. I'll put a link to it in the show notes. And if I don't have anything else going on, I might decide to quit my habit of watching paint dry and turn on that subcommittee hearing instead. That'll be
that's truly nerding and geeking out when you get down into watching that stuff. But I'm there with you.
The thing is with issues like this, with UnitedHealth Group and having the CEO there, for us in this industry, it makes sense to keep on top of that kind of stuff. Also because obviously he's a newsmaker in this particular industry. I'd be interested to see, and what I'm also interested to see is what representatives are going to ask about. If they're going to ask about specifically the cyber attack, or if they're going to talk about exactly the issues you brought up at the beginning of this segment, is you have financially benefited from this cyber attack by buying out companies, offering loans to different provider groups because you couldn't pay them. And that's something I'd be interested to see if he gets asked about, and if he'd even answer those kinds of questions. But again, that's May 1. It looks like it's of course I closed out of the tab right before I started talking. It's the Energy and Commerce Committee in Washington. So we'll see how that is on Wednesday, May 1. You're listening to the FLATLINING Podcast from Fulcrum Strategies. I'm Matthew Handley. We'll have more when we come back right after this. Back to the FLATLINING Podcast. I'm Matthew Handley here with Ron Howrigon, the president and CEO of Fulcrum Strategies. Coming up in a few minutes, Ron and I are going to talk about a ER group that went on strike in Detroit last week for 24 hours. But first, Ron, I want to talk about a new web portal that the Biden administration has set up through the Justice Department that allows people to file complaints for healthcare anti-competitive behavior. My first question is how much do you know about this, and who is this really for?
So I think there's a couple things going on here. Obviously, we've talked about this earlier on the DOJ going after UnitedHealth Group for antitrust violations. You know, once McCarran-Ferguson got watered down and the insurance companies are now fair game, obviously from the pursuit of UnitedHealth Group, this website, et cetera, the Department of Justice has them clearly in their sights. And I think rightfully so. It is it's the biggest part of the U.S. economy, healthcare. Insurance companies now are about 30% of the total dollars amount flowing through the healthcare industry overall. That's huge, okay? And there's an awful lot of there. I mean, we know that most states, when you look at their HH index, are well beyond what they think are competitive environments, and it's just getting worse. So, you know, I think this website is another way for the DOJ to gather as much information as possible about anti-competitive behavior. I think they're going to use this data, you know, how many complaints, et cetera, what types of complaints, for two reasons. One, in their cases against the insurance company, they're going to show, well, look at how many complaints we got of people who say they're being injured by this. That helps. I think they're also looking at this for where else should we hunt? You know, where should we be looking? They might get a complaint here to say, hey, this is happening in this market that they don't know about. And they would say, okay, well, great. You know, now there's another place for us to go after. So I think the insurance industry and the insurance companies who have had a really good gig for a long time need to take this stuff seriously, because I don't see the DOJ going to sleep anytime soon. And until they get defeated in court, they're going to keep going after this.
The thing is, I see when I'm clicking through this web portal and some of their FAQs and their descriptions in here, is it seems to be very patient-centric, which makes sense. They're looking out for patients receiving healthcare. Under one of these FAQs is an example that they provide for what anti-competitive behavior looks like. And I'm pulling this out because it interests me specifically because it deals with what we deal with at Fulcrum Strategies. A hospital system or insurer inserts language into their contracts that keeps patients from knowing the negotiated rates or the other costs of services. I know all of our contracts have non-disclosure agreements in them. And I know the patient gets to see the rate when they get an explanation of benefits. Is there something else that I'm missing from that might open up contracts to more public scrutiny than what they already are?
No, it's exactly what they're looking for. And this is that whole transparency thing that the government's been looking for. And to a large degree, consumers have been looking for. Why can't I know ahead of time how much this is going to cost me? Why can't that be published on a website? Why can't I call up and say, hey, I'm getting ready to deliver a baby. How much is it going to cost me? Because I have a deductible, and so I'm going to be paying this bill. Now, it is a little bit more complicated than that, because there's a fair amount of that, well, I don't know. To take the delivery thing, if I'm a hospital, I can say, well, first of all, I don't know whether you're going to have a C-section or not, and that'll change the price. I don't know if the baby is going to be underweight or sick, so they're going to have to stay in the hospital longer. That's going to change the price. I don't know how many days you're going to be here. Mm-hmm. I don't know if you're going to labor for 3 days and then deliver. So it's not as easy as saying that's a loaf of bread, it's $2. But it's also wrong to have everybody hide behind, oh, well, that's confidential. You can't know, until until it's too late, kind of thing, and you've already purchased the service. So But this is exactly what they're going after. They want more transparency. They want it to act more like a free market consumer choice, because if you could know what they want to have happen is a woman saying, well, it's $5,000 at this hospital, it's $3,000 at that hospital. Now I'm going to make a choice on which one I want based on that information.
And generally, I'm all for that kind of price comparison, in pretty much anything. But I wonder too with healthcare, because we talked about this before, is sometimes that price difference also means quality. And the top of the line equipment, imaging equipment, best radiologists, best OBGYNs, that's another thing that patients need to consider too when they're looking at this kind of thing.
Well, and that, in a marketplace that's efficient, the consumer would have information about price and would either have good information or perceived information about quality. Now, sometimes that's marketing, and,
sure.
and we've talked about, most people really can't tell the difference between a cup of Starbucks coffee and a cup of McDonald's coffee,
Yep. But
there's perceived quality. That's fine. As consumers, we get to do that. But, I can, if I'm deciding between purchasing a much cheaper PC or an Apple MacBook, I know what the price difference is, and then I have some intrinsic idea of quality, and I can make that choice. And some people buy PCs and some people buy MacBooks. Mm-hmm. The difference in healthcare is I don't know the price difference, and so I can't even get to that quality difference because I don't know. If I knew the difference, then I could make that intelligent, rational purchasing decision.
Or you're weird like me, and I've got a PC, a MacBook, and a Chromebook, just to see how they all are.
You're just indecisive. It's what you are.
What? That is totally true. And as another aside, and we don't have to dive into this, my wife will tell you, I am every loyalty point marketer's dream person.
Yeah.
Anyway, that's something else. Let me ask you this about this portal on the Justice Department website. Obviously, it's open for anyone to submit a complaint. I think here, looking at this, the goal is to go after big insurance carriers, because as we've talked about before, we know Justice Department has UnitedHealth Group in their sites. We know they've got them in their sites over uses of their automatic denial systems. Is there a scenario where this could end up harming providers, this kind of complaint system?
Well, it can, because there are definitely some providers, some hospitals, some medical groups, some of our clients who have a pretty dominant position in their marketplace, where you are, maybe not the only group in a certain specialty, but you control a fair amount of that. And so then it opens up, well, are you using that market dominant position in anti-competitive behavior? I think it will be much harder for these kind of cases to go against individual medical groups. Hospitals, should be careful about it, because we work in a lot of areas where there's only one hospital in each county. Mm-hmm. And so you could say, well, that's a monopoly. But I think the carriers are the most likely targets.
We'll have a link to this in the show notes and at flatlining.net if you're interested. It's also got links to the federal laws that ensure healthy competition and some of the stuff we've talked about before, including the Clayton Act and the Sherman Antitrust Act. They've got links to that here as well. Ron, the last thing I want to talk about today, we've talked before about private equity in healthcare and our reservations we have about private equity in healthcare. I think some of those reservations are coming to reality recently. At Ascension St. John in Detroit last week, emergency physicians and physician assistants walked out and striked for 24 hours. They were striking for, they said, was better staffing in the emergency room and better pay. What's important to note is that the emergency physicians are owned by Team Health, which is a private equity backed emergency medicine group, and they're not owned by the hospital. The hospital also said they had backup plans as they were aware that the strike was going to happen. So Ron, I guess my first question is we talk a little bit about private equity before. Can you give me a little bit of a primer on what private equity looks like in, this specific example, emergency medicine?
Yeah, so what some of these companies have done, and let me start with, there are some of these companies who've done a really good job. So it's not a blanket, well, they're all evil.
Sure. Yeah.
But there raises some concerns whenever you deal with private equity, because basically what this is just exactly what it talks about. Private investors who pool their money through some of these companies, who then invest in and take an equity position in some other entity. So in the case of Team Health, a company that sort of grew and used private equity to fund themselves, where they would go out and buy ER groups. They would cash out the doctors. Those doctors would become employees and be part of Team Health. And they created these very large national hospital staffing companies. That in and of itself isn't necessarily a problem. The problem is the investors in these private equity firms did it for a return. And so they want a return on their investment. Sometimes the way to get that return is not always what's best for the patient. So, for example, if you take emergency medicine, if you're not getting enough profit or you're not getting the return that you want, one of the ways to help produce more profit is to lower staffing rates. If hospital A typically is staffed with 3 doctors and 4 PAs, well, there's no law that says I can't staff it with 1 doctor and 2 PAs. I'm meeting the minimum requirements of keeping that ER open. Now, if you're the 3rd heart attack that happens to roll in at the same time, probably not going to make it, because they've only got 1 doc and 2 PAs. If you're there, with a pretty serious situation, you might have to wait a while because they don't have to staff anything to cover it. So those are some of the concerns that happen to say, well, are they putting profits before patients? And it's a concern because a lot of times what's profitable is not good care. And that's largely what these doctors went on strike about. Was they said, look, we can't make these choices anymore because we're employees and they get to decide what our staffing is, and we don't like this. We don't like what it's doing to the care we get delivered and stuff like that. So, and I think one of their slogans was safe staffing saves lives, and it does.
Yeah, that's one of the things that on the picket signs that they were carrying. The other one was no more profits over patients. Mm-hmm. One of the physicians or physician assistants that was interviewed in this article by the Detroit News said that they were fighting against wait times of 17 hours. Is that something that you think is common in instances where staffing has been cut at different hospitals?
It's not uncommon. And it's a direct result of, it's an obvious thing. If you cut staffing, you increase wait times. One of the other problems with emergency medicine is you don't know what the load is going to be. So a lot of ER groups overstaffed. We don't know if Friday night is going to be this many patients or a whole lot more. Mm-hmm. It's not like a regularly scheduled day where you know how many patients are going to come in. And you can understaff it, and then when you get hit with a bolus, with a bad, a big influx of people, you can run into some really nasty wait times. And they triage to make sure they deal with the most serious issues first. But I think every ER physician would say that a 17-hour wait time is not good medicine.
For their part, Team Health says that they have been negotiating good faith with the union. With this group, they did vote to unionize last year. They have been negotiating in good faith with the union, and they are inviting the union leadership back to the bargaining table, and that the median door-to-door time at Ascension St. John's Emergency Department was 25 minutes last year, and so far this year is 15 minutes. In an instance like this where you have physicians on strike, and I'm not saying they don't have the right to go on strike, they are a union, but I wonder who hurts in this instance. Is it Ascension St. John's, the hospital? Is it patients? Or is it Team Health that gets hurt?
Well, I don't think, other than the public relations problem, Team Health doesn't really get hurt. The hospital always, because they've got to figure out a way to staff it. The patients definitely do so. One of the things I think we should be very grateful of is that I don't know of any example where physicians have done the kind of long-term strike that would truly put patients at risk. For example, what I understand is the Ascension thing is The hospital knew when it was coming because the ER group told them. And
Right.
they told them so that they could have other capability, because what they didn't want to do is walk out of an ER and leave all these patients. Okay. We've seen in other industries, and I get it, it's not as people don't die, but when an auto factory, when everybody walks off the line, nobody dies, but they can grind the line to a stop.
Yep.
What happens the day that doctors say, you know what, I've had enough, and we're not going to give them notice, and we're just going to all walk out here at midnight, and all these patients are stuck? And again, I think we should be grateful that doctors don't do that, but boy, in some cases you might think they'd be justified in doing just that. And that's really problematic. And I hope that folks like Team Health, and I don't know their situation, but don't take advantage of doctors' good nature and their commitment to their patients, because Lord knows Medicare does when they keep cutting their reimbursement.
Yep. I as just a final thought on this particular segment, I do think, only because Americans are not very nuanced, and sometimes the media is not very nuanced, I worry that the hospital gets hurt in all this, particularly from a branding perspective, because I don't think people necessarily look at the fact that the emergency medicine physician is employed by someone other than the hospital. They just see the physician outside the St. John logo holding a sign saying no more profits over patients. I do worry about that, only, like I said, because the media and Americans tend to not be very nuanced in these instances.
We are a microwave society.
Yeah. Yep. That's going to do it for this episode of the Flatlining Podcast. We'll have this article from the Detroit News linked on the show notes. Be sure to subscribe wherever you're listening to podcasts, and do us a favor, go ahead and share it with a friend, a colleague, coworker, whoever. Share it on social media. That helps us out a lot. It also helps us out a lot when you click the like button and the subscribe button. That way you won't ever miss an episode of the Flatlining Podcast. Ron, thanks for sitting down with me today.
No problem. Thank you.
Miss an episode of the Flatlining Podcast? Well, now you can read a recap. Just go to flatlining.net and look right there on the homepage every Monday for a written recap on last week's episode.